Been asked quite a lot recently, is the coronavirus more likely to affect me if I've had something like chronic fatigue in the past? Now, chronic fatigue is something that we deal a lot with and have done it for the last 20, 30 years, 20 years with the lining process. So there's a lot of people that we know who have had it, who are now well, but they're saying, does this make me more likely to get it or to get long COVID? And the answer is, in our experience, no. There's no reason you should be more susceptible, because if you've used the tools that we've given you, what you should have been able to do, and that's what most people achieve, is to get their health back. Now, when your health is back, then you are indistinguishable from anybody else. You're able to run as far as they are. If you really shifted this condition, you should be able to compare yourself to the next person and go, well, we're as healthy as each other. And in fact, if you've done something like the lightning process, you should also have an understanding of how stress affects the immune system. And this is one of the problems generally with long COVID and COVID, is that people stressing about it is probably not going to help, because long-term stress does suppress your immune system function. So people who've done the lightning process should find that they're more able to get themselves back to calm amidst the kind of madness of the pandemic. And the other thing is that these skills, using the mind-body connection, also allow you to take those moments when you're calm and switch the way your brain is pointing, so you start to stimulate good immune function. Because we know from research there's a huge linkage between what you're thinking, what your worries are, what your thoughts are, and the function of your immune system. So we mentioned that stress suppresses it, but there's also some really interesting research, particularly from Spear and Delgado, whereby connecting with really good positive memories buffers the stress response. So when we get stressed, we produce a spike in cortisol. If before a stressful event occurs, you're able to get yourself into a calm or happy space, then instead of this spike, you get just a tiny little blip. So there's a change in your physiological response. And then Langer did some great research as well into getting people to remember what it's like to be a teenager. And by reconnecting with being a teenager, it changes all sorts of physiological markers. So we know that if you can reduce your stress, so your immune system is not being knackered by that, and B, enhance the way your physiology is working, using all this research into placebo response, mind-body connection, these kind of things, that you're working in both directions to ensure your body has the best chance of either not getting the coronavirus, because if your immune system is strong, you've got a better chance, or if you do get it, being able to bat it off more easily and therefore have a much shorter term illness with less severe consequences and avoid the chance of going into the more long COVID type things. So does that mean if you do the lightning process you'll never get long COVID? Of course it doesn't mean that. Everybody, has a chance of getting it. But these things are likely to reduce your chance to get it and reduce the severity of the impact. And that's a really useful tool to have at your disposal. Because as we go through the world, we always come in contact with viruses, bacteria, bugs and germs. And having a way to minimize their effect. Again, we're not saying you can completely avoid them, the world is the way it is, but having a way to gain influence into the way your immune system works could be really, really valuable. So I hope that's a useful starting point for anybody asking that question. If I've had chronic fatigue and I've got rid of it, then is the coronavirus of any more great risk or less risk to me? And, as I say from our experience, using these skills, and I'm talking about the lightning process a lot, but it really applies to any skills you have that can impact your immune system in a positive way, are going to make a difference. So Pasteur, the father of kind of bacteriology, you probably heard his name in Pasteurization of Milk, he came up with this whole idea of the germ theory of disease, the idea that the germ comes along and that's what causes the illness. And before that, there was a different kind of model that the body humours were causing illness, and he proved that germs, really were responsible for illness. But apparently, in his final days, he said, I'd like to just slightly change my perspective. He said that the soil is as important as the seed. So the state of the body, the wellness of the body, and the germ, and the bug, and the bacteria and the virus, the combination of those two things. So if the body is not functioning well, and the bacteria or virus is strong, you get the biggest response. If the bacteria or virus is weak and the body is healthy and strong, it can respond more positively to that virus. So it's a much more kind of nuanced thing rather than, we've seen this in the virus and the coronavirus. Somebody will get it in the house and not everybody gets it, or not everybody gets it in the same way, because there are these other factors, the strength of the actual bacterial viral agent and the wellness of the body. So anything you can do to reduce your contact with a bug would be useful, and anything you can do to boost your immune system would also help.